Good morning. Excuse this. We are coming to you live from San Diego, where I'm joined with Eric Westman, and we are at the Obesity Medicine Conference. And today's a special day because we're going to be doing an Adapt Live, and we're going to be taking your questions. So please be sure to send us those questions if they are keto or low carb related. We're going to have Dr. Westman answer them. We cannot, unfortunately, answer any medical related questions, so just keep them on topic of either low carb or keto. And before we get going, I have been in the United States for the last 2 weeks, and we attended...
How are you doing?
I'm doing good. We attended our very first Adapt event, which was Adapt Virginia. And I've had the honor and pleasure of watching Dr. Westman present many times. And this particular event was quite unique because there were two stories that were told that were quite rewarding. And I'm going to ask Dr. Westman to share them with you. The first story was Dr. Westman has been doing this for the last 20 years, treating people in his clinics and using a low-carb lifestyle. But one of the stories brought Dr. Westman, or one of the incidents brought Dr. Westman to tears. So I'm going to ask him to share that story with you.
Okay. Gosh, so in Winchester, Virginia, I think there were 160 people. So,
160, yeah.
So I was trying to just recreate what I had seen in the clinic that week, leading up to that week. And so someone had come back to me the first time back after starting the program, and yes, the hunger was gone. She had lost some weight and was feeling a lot better, but what was pretty incredible was that she brought a bag of materials, and so she pulled out, Dr. Westman, I've had chronic pain for so long, and you heard me and you said that this might help, and I'm feeling better, but I'm still having pain. But I just want to show you what I looked like before I was heavy and before I was in chronic pain. And so she pulled out pictures of herself when she was a kid, when she was in high school and college, and she was thin and feeling great. And then the time passes, and she turned to me and said, "And Dr. Westman, you're the first doctor that's given me hope."
Right.
And I had never had anyone who brought it that close to home, and I guess in front of the audience and all that. I don't remember getting really emotional, but I guess I did.
Shed a couple of tears?
Yeah, I guess a new video did. So, but those kinds of moments are what why doctors like me do this. It's not, I mean, anyone can cut the carbs and do that, but it's almost like, I use the term that it's the clinic of last resort, meaning people have tried everything, right, and just a simple thing like cutting carbs can be so effective. So yeah, that was the giving someone hope, and that she was actually feeling better after just a couple weeks, right, when she had not felt better, even just a little better, right, for so long. Yeah.
Okay, now, quite an interesting one is, I heard you got somebody pregnant.
So,
Did you hear that? I said pregnant, well, at his clinic.
I got one of my patients pregnant, but it's not what you think. And this is a classic. We're at a meeting here of obesity medicine specialists, and most of us are internal medicine or family medicine. We're not OBGYN, or we're not fertility specialists, and we're not like philandering with our patients. So the way it works is this certain person had been trying for 5 years to get pregnant using medication at a fertility clinic, and she hadn't had any success.
Right.
And so she was still on the fertility medicine, but she changed the diet, and within 6 weeks of cutting the carbs out, going keto, she got ovulated and she got pregnant.
Right.
So indirectly, I helped someone get pregnant, and but that's not something I do every day.
Right, and I know that you mentioned that this has been mentioned in a study with PCOS many times, or a long time ago.
Our study was published 10 years ago.
Right, okay.
Yeah.
Okay.
Yeah.
All right, so guys, if you have any questions, please put those down below, and be sure we'll be answering them. Now, hi to everyone that's giving us a shout out. Lora Lee, James, Aaron, everyone that's Melissa, Debbie. Hi to you guys, and thank you very much for your support. Before we go on to some of the questions that I've received over the last couple of days when we announced this, I I just wanted to ask Dr. Westman, there's been a lot of focus on the keto diet and the low carb diet in the last couple of years, which has been abnormally high compared to the history. What do you attribute that to?
Well, I think pretty clearly the science.
Right.
The science is there to support it as a healthy thing to do. So I think the pushback came from science and people trained in other ways. They weren't aware that this was something that could be done, but now there's a body of literature of science and lots of different investigators having done it. So it's not just one person saying
right.
it, and I think that's well, of course I'm a scientist, so I'm going to think it's the science.
Right.
Maybe it's because the products are easier to get, right? I mean, we've seen a explosion of cauliflower rice,
correct.
cauliflower mashed cauliflower,
correct.
cauliflower pizza crust, adapt products. So
right.
the more that it becomes easier to do, it will be more sustainable and it will be more popular, don't you think?
Well, either way, as long as we can get this message out to as many people as we possibly can, for the last couple of years, no one actually knew. Well, very few people knew about this type of lifestyle. When you go to the restaurants or when you go to the store and you ask to have your eggs fried in butter, people think you're absolutely nuts. So we have a question here from Mancy Kluck, and that is, can you talk about leg cramps?
Yeah, sure. So when you're changing from eating carbohydrates to not eating carbohydrates, you might experience some side effects. We call those keto adaptation or transition symptoms, and leg cramps is one of them. Maybe, I don't know, a quarter of people, 25%, might get leg cramps. And the remedy that we find most effective, because it's quick, is milk of magnesia, so a little bit of magnesium or electrolyte replacement. In our area, you can get an over-the-counter milk with magnesia supplement, and you just take a teaspoon of that at bedtime for a week. Now, in the background, really having adequate salt, again, another electrolyte, sodium, and salt and water is important. Of course, if you don't have high blood pressure or a history of heart failure, so if you're not a clinical patient, adding more salt is a good way to prevent the leg cramps. And then there's a home remedy of a squirt of mustard, and that'll take it away. But I like the magnesium one because it replenishes your body with an electrolyte that a lot of people don't have enough of.
Okay, that's great. We have another question from Georgia, keto low carb of northeastern Georgia. Larry Minogue asks, Dr. Westman, when did you first get started studying keto low carb? What nuts are best to eat and how many per day? Hey Larry, good to hear from you.
Well, so, I got into studying low carb diets because a couple of my patients did it and I didn't know anything about it. It wasn't any personal, great weight loss story. It was one of curiosity.
Right.
And knowing that everyone thought it wasn't safe, the critical question for me, I knew it could work, but it was it safe or not?
Right.
And so now, 20 years later, so it was 1998. So that's about 20 years ago.
Right.
And it's 2018, right? So the question about nuts is interesting. So in my clinic, in my area, the availability of nuts is so easy that you can get a tub of nuts like this and they can become uncontrollable. So at first I ask people not to have nuts if they're just getting started. But it's all a matter in the science of the number of grams of total carbohydrate.
Okay.
So if you count out how many total carbs in the nuts, the seeds, the berries, the whatever, and you can stay to that, it will work. But many people getting started can't stay to that. These are triggered foods. So
Is there any nuts that you have a preference to if you're gonna?
not really.
Not
so
really, okay.
I guess there's the lumper and the splitter kind of mind, and I look at the total carbs. You could look at micro, macadamias have a little more fat than others.
Okay. All right, we had another question from Marianne. She asked, is keto lifestyle safe long term?
Yeah.
That's one we get quite a lot, actually.
That's interesting, because at best we know, so it's basically, I don't, labeling it as keto is a good thing and it's a bad thing.
Right.
It's a good thing because it's new. It talks about how you're burning fat and you're using ketones, and it gives you that concept. But the bad part of it is that it seems like it's something bizarre or
Right.
weird or abnormal, when really you're just not eating sugars. The starches have sugars and get digested to sugar, and so you're eating real food.
Right.
So it's I prefer to come at it like to explain the healthiness or safety, that you're really kind of eating an ancestral paleo, hunter-gatherer, primal, not those specific brand names, but it's more that this is the way people ate for so long, and it's weird to think that might be bad.
Right. And I know one of your favorite sayings was, "Where's the body bags?"
Yeah,
Is that right? Heard
Right.
you saying that a couple of times.
Yeah, so if it was so bad for people, why aren't they showing up in
The body bags, in the mortuary.
in the mortuary?
Right, okay.
Well, that's a little harsh there.
Okay.
Well, but last summer now, the mice that were, so middle-aged mice were put on a keto diet.
Okay.
Or the regular chow, which has carbs.
Right.
And the mice lived 13% longer if they were living keto.
Wow, okay.
So now we're not mice.
Right.
And these were middle-aged mice,
Right.
a year old, that were, I'm really curious if you started the mice
Earlier on.
they
Okay.
might even do better.
So are you finding that there's more studies being done on keto with humans, in human trials?
Yeah.
Okay.
Yeah,
Well,
at
that's
all levels. So now
Okay.
there are test tube studies being done. There are mice studies. There are so
A lot
you're
of
gonna have an
focus, a lot of
explosion
focus.
of
Well, that's
knowledge coming
fantastic.
out. Yeah.
Another question, Antionette asks, have you seen folks decline health-wise? Which we've kind of just, well, that was if you've died, or how safe is it? But have you seen, in your history, have you seen anyone decline health-wise by going on this? Some people, there's a very small percentage of the population that cannot metabolize fat. Have you seen anyone decline
That's
health-wise?
really rare.
Is
That's
it
really rare.
You haven't seen something like that?
If someone has a really serious metabolic problem, they don't get past childhood.
Okay.
So if you're dealing with adults, you're not going to have
That kind of
bizarre
issue. Okay.
problem. And health decline. Well, people do die. I don't think
Right.
this is a pathway to immortality.
No.
and in my clinical practice over the last 12 years, I've had some people die. So I can't say that it was related to the diet,
Right.
though. So things still happen that are not related to the diet. People get into car accidents, and so
Right,
I
of
don't.
course.
But I can't think of anyone who started eating this way and then just felt
Started declining.
bad. And if that's the case, then they're not doing it right.
Okay.
There's a little trick to making sure you get enough salt.
Right.
Making sure you're not eating a lot of fake foods and with a lot of additives.
Right.
And, drinking oils, and I see people drink oils and they complain of stomach trouble. What's causing my stomach trouble?
Right.
Well, it was the oils.
Right.
So sometimes it's that simple.
Okay. We have a question here from Lora Lee Carver. She started keto on March the 16th, and her blood sugar has dropped from 130s to 40s to 114 to 120. Now, of course, we cannot answer a direct question, but generalization in terms of someone that starts it and then their blood sugars have dropped substantially, or would you say that's substantial?
Yeah, sure. So in the U.S., blood sugars are, normal blood sugars are 80s to 90s, 80 to 90 milligrams per deciliter. And so that's about 6 in millimoles internationally. And any kind of reduction in 10 or 20 points is significant. That's a good improvement. Of course, we want to be careful if you're on medication, because the blood sugars can come down really fast, and it's the medicine that can cause problems. So
Right.
you want to be monitored if you're on medication. But blood sugars should be in the 80s and 90s off medicine, and then you don't have diabetes anymore. But that's a good response, yeah.
Just a quick one. I know that a lot of people send us requests all the time, and they're from all over the world, and a lot of people from all over the United States. And I know that it's difficult to find these doctors, but you can maybe just tell the folks that you do have heal clinics that are starting up all over America, and that you could be able to, you can help people remotely. It's something that's quite important. If people, finding it hard to find those doctors or find that help. Is there anything you want to say to that?
Sure. Well, so, when you visited, it's been a few years ago, to our clinic, I remember you said there were at least two things that needed to be fixed.
Right.
One of them was getting the products that were truly low carb, and you
Right.
solved that. Thank you. And so the Adapt products are fantastic.
Thank you.
The other thing that you noticed and I've noticed is that there needs to be more availability of the teaching, of correct teaching. And so creating the free information at the Adapt website is fantastic. You can find a video on how to get started, but if you need advanced support and more training, then the Heal Clinics comes into play. Heal Clinics can teach you and support you remotely if you don't have medical issues.
Right.
If you have a medical problem, you have to see someone in the clinic to help you get off the medication safely. And now we have 3 new clinics opening in Northern Virginia. There is one in Durham that I've been in for several years now. But check out healclinics.com, and of course the free information at adaptyourlife.com.
Wonderful. So if they wanted to find out if there's a clinic, is there an email address that they could maybe pose a question to?
Well, go to healclinics.
Just go to healclinics.com. Okay, fantastic. Let's see if we've got another. Amy Berger. Hi, Amy. So good to have seen you in Winchester, Virginia. And Amy's question is, why does it always seem harder for women to lose fat on a keto way of eating compared to men? Are the hormonal differences really that powerful?
I'm afraid so. You know, I try to insist if it's a couple that they take pleasure in other people's success rather than feel bad because you're not losing as fast. But no, so definitely the hormonal fluctuations that women have will make it more difficult. You know, the younger you are, the less concerned you have to be about carbs. The older you are, the more you have to be concerned about carbs. Right. Then of course you have hormonal cravings that can occur. But we did learn how to give people chocolate. That's a must, right? So the Adapt products, the you know, a low carb protein chocolate shake can be a way to get that. And but yeah, I would just, you know, hang in there and realize that it might be slower.
Okay. George Kelly, how you doing? Good to see a thumbs up from you. Melissa, hi there. And let's see which other questions we have. We have, what is the difference between the ADAPT program and the Atkins program? That's quite a good question.
Yeah, so the ADAPT program is really a offshoot, or should I say an evolution of many different programs. Okay. So it's an updating of what Dr. Atkins knew, Dr. Eads, Mike and Mary Dan Eads used low carb in their practice for decades. Right. It's an updating based on what Dr. Bernstein knew and knows, who generally teaches people with type 1 diabetes. So it's updating that information, but it's definitely related. So I think what these other doctors didn't really focus on so much was how to optimize the omega-3s and omega-6s. Okay. That's kind of a new concept for the extra reduction in inflammation. You want to be mindful of that. They weren't really into the grass-fed beef idea. Those kinds of things just weren't available. Okay. Although Dr. Atkins had this notion that he taught me that if someone was stuck, just move to Europe for a while. He treated people who could just move to Europe, I guess, and because the food supply was different. Wow! So he thought there was something
Never heard that before.
In the U.S. agricultural processing that could make people have difficulty. But so I guess the food quality issues are something new that are different. But I guess it's most related to the what was called the Atkins induction, or first phase of South Beach, but it's not low fat like South Beach, or protein power, Mike and Mary Dan Eads. It's very related to that. But I guess it's like, you know, is a musician trained with Bach and Beethoven, and so it's related to those things, but unique.
You know, you mentioned something that I haven't actually heard before. I never knew that Dr. Atkins, I don't know if that's serious, that he had actually sent people to another country. Is that
well, he would say that if you were stuck and you could travel to another country, just don't have the American food supply. Yeah.
Just a question on that. How about if somebody is stuck, would you suggest that they possibly
move to Europe?
Well, besides moving to Europe, maybe change some of the items of food that they're eating, maybe change the grocery store? I mean, do you think that's
interesting?
Do you think that could be something?
Well, you know,
worth a try.
It's worth a try. Right. In the big picture, I guess my role is to get people started into the leap of lower carb and then there are all these different variations that it's worth trying if you are
Right.
stuck.
Okay, we're nearly at the end here. Let's see if there's any other questions that came online. Lisa Fleming, how you doing? Always good to hear from you. I got a question from Anonymous. She says, are you open to going on a blind date? Well,
I'll leave that up to Glen.
okay, and then
My agent.
I'm not sure if Yale is watching, but Yale says I must do this.
Oh.
And that's live on Ask Adapt. So guys, we really appreciate your support. Thank you very much for, this journey has been absolutely amazing for us. We only ask that you share this information. If we can share this video and it can help just one person, we feel that we've done our job. So please go ahead and support us. Subscribe on our YouTube channel under Adapt Your Life, or our Facebook channel under Adapt Your Life. And please try and share the videos as much as you possibly can. If we are getting momentum now, can you just imagine in the next 5 to 10 years? This information needs to get out there. Melissa says, I think we're going to maybe take one or two questions. My husband has been keto for 8 months and he's lost all fat except his belly. What can he do? Just the belly fat.
You just have to keep persisting. That's often the last to go.
Yeah, something that I'd like to mention, and this isn't from a medical standpoint, but unfortunately we've been programmed as humans to think that, let's say for example 10 years ago or 20 years ago it was fashionable to be curvy, and then it becomes fashionable to be very anorexic, and then it becomes fashionable to be, unfortunately our bodies don't work just because of the way the media wants us to be. So, for example, when we say, well, I'd like to lose a little bit of weight just here and just there, unfortunately, sometimes our bodies, are different to somebody else's, and they lose weight or they lose fat in different places. It's not a one-size-fits-all kind of program. All right, there's one more question, and this is from Laura. We'll get my blood sugar back there. Been off 2 blood sugar meds for the last few years. Been a diet-controlled diabetic since. Low carb and keto are truly lifesavers. We love hearing stories like that. Thank you so much, Laura. Please will you again share this video and many more like it, and we thank you so much for your support. And from the Obesity Conference in San Diego and myself and Dr. Eric Westman, we say thank you and over and out.
Thanks, Glenn.
Thank you.